We are here on Doc Talks to talk about pediatric development. And she is, to me, a celebrity. And I'm so excited that I got to meet her and that she was willing to come on the show and talk about something she's passionate about. I'm going to give a little background. And first, I want to say hi.
Hello.
Hi,
So great
Dr.
to be
Kraft.
here.
So Dr. Kraft was a professor of pediatrics at the Keck School, or is currently at the Keck School of Medicine at USC, and a co-director of IMPACT. That's Improving Medicine, Pediatricians and Communities Together. That's a track in the pediatric residency at CHLA, Children's Hospital, Los Angeles.
Right.
Of importance, she is the 2018 past president of the American Academy of Pediatrics, which for those of you who are not in the world of pediatrics, that's a profound position that she was elected to. Dr. Kraft received her undergraduate degree at Virginia Tech and her MD from Virginia Commonwealth University and her MBA from the University of Cincinnati. She completed her residency in pediatrics at Virginia Commonwealth University. Dr. Kraft is known for her work in integrating care for children with developmental disabilities and behavioral health conditions into primary care pediatrics. Her interests include the study of technology and its role addressing health disparities and the unconscious bias in children. She continues to speak for basic child rights throughout the world. And I've seen a lot of that in the media, thank you, during these last years, during the Trump administration. So I asked Dr. Kraft what she would be interested in talking about, and it's just a lovely topic about one of the most common topics that come into the pediatric office is developmental concerns that parents have. So we'll start there, and then we can talk about some of how that passion came to be for you, because I think that's interesting to hear about your story. So our first topic is streaming at the bottom here. How to recognize developmental delays in children.
That's a great question because, especially if you've got your first child, you're not always going to know whether their development is typical or not. And by development, we're looking at the things that children do. Their gross motor skills. Are they crawling? Are they rolling over? Are they pulling up to stand? Are they taking those first steps? And recognizing that there's actually a big range. I mean, walking, some kids will walk at 10 months, some kids will be 15 months normally.
Mhm.
Looking at fine motor, are they picking things up? Are they using a pincer grasp? Are they able to use utensils or draw a circle? Social and communication, really important. Do they understand what you're saying to them? Are they trying to bring you something to share together, a toy or a book or something that they want to share with you as their parent? Are they interacting with other children and other adults in the right way? Are they actually making the words and putting the words together to express the communication that they need to express? That these are all really, really important parts of child development. And we think about this, and now the pediatricians and physicians who take care of children are actually doing things called developmental surveillance, where they're looking to see if that child, in the context of any visit, is doing the right things developmentally. I talk with my families a lot about development being like a third leg. If you walked into an office and your child had a third leg, you would say, "Ooh, there's a problem with that. We got to do something about it."
Mhm.
And and really, if you bring in a 2-year-old who isn't understanding or saying anything, if you bring in a 4-year-old who only repeats words that you say, that's the third leg. That's
Mhm.
something that says, okay, we've got to take care. Even if you brought your child in for a fever or a cough or some other reason, development has to be there. And that's what developmental surveillance is. The other piece of this is that pediatricians are beginning to do developmental screening, where they are asking you as parents some specific questions about your child's development. And if there's a red flag noted, then they're looking at where we can get your child to the right amount of help. What if you're a parent and you're concerned about your child's development and you're
Mhm.
not sure what they should be doing at this age? There is a great free website at the CDC, the Centers for Disease Control. And if you were just to type in development and children, you get put to the milestone tracker. And what the milestone tracker is is a website that you could even convert to an app to essentially put in your child's age and look to see, are they doing the right things that a 9-month-old should be doing, or a 12-month-old, or any other age. And that will give you a really good idea of, are they doing the things that children should typically be doing before you actually go on to see your pediatrician.
That brings up a question I have, and I'm just typing in notes here so people can go find the milestone tracker. So yeah, we're very good about looking at, we have on a piece of paper as a pediatrician, this is where we want you to be, and we're always told there's lots of preemies, so maybe you can speak about what you expect of a premature baby, if 2 months or more premature. I know that we can scare parents quite a bit when we say, oh, they're not doing that. They're not sitting at 6 months. They're not sitting at 9 months. What do you feel comfortable with when a child's, do you like to have them, when a child's behind in a developmental milestone, and of course it's going to vary on which one it is, do you like to do early intervention right away, or do you like to have them follow up in a month? Because sometimes the parent didn't even know to engage a child to wave, or didn't know to practice more tummy time and have them using their muscles. What is your standard approach when you do see a very mild deficit, or something just at 6 months they're not sitting?
Really, really, really great questions, because there is a normal range of development for children.
Mhm.
And I really base the answer based on that child's trajectory in general. So I will be very different answer if you have a preemie versus a term baby, because you really have to actually subtract that time that that child was premature in order to get an accurate developmental milestone. But if there's a milestone that a child isn't meeting, but they're close to it, and there's some things that parents can do to try to help to promote their development, then I will often recommend that. But I always talk about early intervention. And early intervention is it's your government at work. It is the 0 to 3 system that in California, it's called the regional centers. It's called different things in different places. But if you look up your state and you put in early intervention, you will find the program that is an option for you. A couple of things about early intervention: your child doesn't have to have a diagnosis in order to seek out services from early intervention. That's really, really important. The second really important thing is that you don't need a prescription from anybody to go to early intervention. You just call the number, and if you're concerned about your child's development, they will set up an appointment with you to see your child, be evaluated in the area that you think is concerning, and talk with you whether, if your child doesn't have a concern, they'll give you some tips on promoting their development. If they do have a concern, then they actually will look into that further and maybe recommend therapies through a document called an individual family services program. And that's something that you in early intervention are going to plan how your child is going to develop, how your child is going to get by some of those concerning milestones in the next few months.
This is wonderful information that I was not aware of. So the individual family services plan can be made with the early intervention program in your state, and you just reach out to them as a parent and say, these are my concerns.
Absolutely.
You don't need,
right. You don't need a prescription. You don't need anybody referring you to early intervention. All you have to do is call and set up that visit. Now, what will happen is that many of those early intervention centers will ask you who your pediatrician is. And sometimes they'll reach out to get some notes. And often, if you ask, they will share that individual family services plan with your pediatrician. And for me as a pediatrician, that's absolutely important, because I will take that plan and sit down with a family and say, you know, they were hoping that your child would be babbling with consonant words by 3 months out. Are we doing this? Are we getting to those goals? If not, what do we need to do to change strategy? So it becomes a roadmap for how we follow your child's development if there is in fact a disability.
This speaks so strongly to the fact that early intervention works. So I imagine that the cost benefit ratio of doing interventions for children who might be on track anyhow is well worth preventing someone falling behind who might be actually behind, and it's a very close call. So I love that we have this model to actually prove the point that it is so worthwhile. I always say, if I'm going to recommend occupational therapy, physical therapy, speech therapy, before we have a diagnosis, take it, because we might never get to a diagnosis. It's just so useful. And I do see people get nervous about labels and worry about things on paper, which I don't appreciate the full extent of how that makes a parent feel. I just know it's a real concern that people don't want things on paper. Have you experienced that?
Absolutely. Let's talk for a minute about labels. Parents really fear labels, and they fear them because they feel like their child will be ostracized or treated differently from other children. But this is the reality. If your child's speech is delayed and they're not communicating, if your child's behavior is disruptive, if your child is not walking when everybody else is, they're still going to be labeled, even without the label. So
Mm-hmm.
let's not worry about the labels. Let's worry about the services that we need to address some of the problems that you may have with your child. That's the most important thing, because if you do that early, you're going to get your child beyond some of the deficits that we see. And we're really going to start to use their strengths.
I flipped to the next topic, which was how to find free resources to help parents. But did you want to say anything more about recognizing? I'll go back to the first before we close. Recognizing developmental delays. I think it's true that this is a place you do want to lean on your pediatrician and find out what questions your pediatrician's asking for that stage, especially
So
for first time. Mm-hmm.
one of the resources that's on the CDC website is about how to talk to your pediatrician. And what's great about it is it helps the parent go through the milestone tracker and identify if there are some actual concerns in through there. And it gives parents the language to bring that information to their pediatrician and say, hey, we looked at this and I think that my son's speech is not where it should be. Or I think my daughter's gross motor milestones are not where they should be. But what I really like about that is that it helps parents with expressing that concern in a way that a pediatrician will understand and will really get them to stop and take notice.
Okay, so I'll add that to the comments later. I'll find that
Mhm.
exact link. It seems like it's going to be very easy to find from what you're
Right,
describing.
right on the CDC website. So yes. Mhm.
And then, of course, there's always the old adage that trust your instincts. If something seems off as a new parent, there probably is something to be looked at, right?
Absolutely.
And
Absolutely.
then, yeah, the age range too, people should not panic. There is a very discrepancy. Parents of multiple children see a huge range between when they walk or when they're talking, and those milestones.
And to really keep in mind that there's going to be some family history of this. I mean, you'll find families where the kids didn't walk until 15 months of age. And so when they're not walking at 12 months of age, most parents will be reassured by that. Some will not. Some will really want to have that evaluated. And that's where early intervention is so helpful, because early interventions model is very different than a traditional therapy model. So you think about traditional speech therapy or physical therapy. What early intervention does instead is it teaches parents the skills to then practice with their kids. And then as they reevaluate through that individual family services plan, if it becomes apparent that this isn't enough and we actually need more of a medical model of something like speech or occupational or physical therapy, then we refer on to there.
These are really great points you're making. I can't believe how much I surprise a parent when I start asking about their family history, and I really want to go into it because they didn't consider it. And they're like, well, yeah, I did that too. And my mom said I was, small for 2 years, the first 2 years of my life. And a parent doesn't always string that together. But on the flip side, there is such an importance in evaluating your child, because if you had a difficult time reading and you were slow to read, you might actually be on the spectrum of dyslexic and you pushed through, and that's just a random example I'm giving. but it's important to also think about maybe there was something missed in your childhood. So sharing your family history or considering your family history is so important.
Yes.
Genes are strong, yeah. As far as free resources, you mentioned some. I'll go on to the next point. I love those because those are new resources to me. I always have leaned on Help Me Grow because it came out when I was starting to practice.
I was
Um,
going to mention Help Me Grow actually, and Help Me Grow OC is a particularly wonderful program, and it actually helps out in one area that a lot of my families find difficulty with, and that is their child's behavior. Because people don't always think about behavior as development, but behavior is really communication, and it has everything to do with developmental milestones. And sometimes we as parents don't know what to do with our child's behavior. And Help Me Grow OC has been a terrific resource in helping to understand and helping to do things differently so that your child behaves in a way that you'd like them to.
Again, a great point that you made about behavior being closely linked to reaching milestones, because we know the child with tantrums, and this is just a very simplistic example, but a child with tantrums at 2 who's not getting full speech is having a lot more, whoops, something just changed on the screen. It's just very interesting that you have poor speech, so then suddenly you just can't get across what your feelings are and your behavior starts to change.
Mm-hmm.
Those types of things. Yeah. I'm going to there we go. I just cleaned. So are there other resources that you tend to recommend?
There's a really wonderful website as well called Pathways. And Pathways is another free website where there are videos that look at what children should be doing at certain ages. But then it also goes into if your child's not pulling to stand yet, here's some videos to take a look at to show what you can do to help that out. If your child isn't saying words, let's look at some ways that you can actually help that out as a parent. And I find this so helpful because my parents really want to know what they can do. They really want to be in charge of their child's whole health, and having the answers to what you can do to help promote development is really essential for them.
Yeah, this is phenomenal. I did not know. I always try to create my own or search through random YouTubes for toe walkers and anything else.
Mm-hmm. Mm-hmm.
Okay. Um, any other resources? I'm picking up some interference. Do you hear that?
I hear a little bit as well too, so it's a little bit better right now. But
Okay.
yeah, I did a minute or so ago. So there are resources that you can sometimes find even in places like the public library, where we're beginning to open up and see these things as well too. Um, Look around. You can even Google some of the family support groups for kids with disabilities, or kids with school problems, or kids with autism. So you can look at any of those types of support groups around there, and a lot of times they're beginning to now have some in-person meetings. They were doing a lot of Zoom beforehand, but to find a person who has been there and done that is so important. Another parent who had that child who didn't walk until they were close to 2, or that parent that has a child with autism, or that parent with a child who has really been through it with the speech therapy or behavior. That is just an amazing resource because you really get the tips from the people who have been there and done that.
Great, good tips. And I find Facebook tends to be a great resource. I've seen groups, you can search plenty of groups and local groups so you can then actually meet up and connect with those families.
And it's a good place to start socializing. As you get your information, some of it is going to be really good. Some of it is really going to be specific in terms of who are some of the therapists or some of the programs out there that really align with your own philosophy. So I have some parents who really believe in very strict ways to monitor their child's behavior and development, and feel like they want to have more of a control on it. And I have other parents who are more of a Montessori, let my child discover this and let them find the joy in what they're discovering on their own. And you'll find if you go into these groups that some align better one way or another, and that you can do this your way. There's not just one way to treat a child who's got a developmental disability. And that the most important thing is that development is going to be optimized in the context of the relationship you have with your child. So, regardless of your child's issues or problems, read to them, sing to them, talk to them, interact with them, play games with them. All of that builds your baby's brain and builds your child's development in ways that none of us as professionals can, because you have that relationship. And all of the developmental promotion is going to happen in the context of that relationship.
This is so true. So sometimes you're your best resource.
Yes, absolutely.
So do you have anything else you want to add for resources?
I'm good with the resources. So,
Let's talk about how to engage your children to develop necessary life skills.
One of the things that's really important to know about young children is that they learn in the context of play. And so anything that you can do in terms of play is really important. One of my favorite play games between parents and kids is something that I actually bring up at the 2-year-old checkup, and that is the feelings game. So begin to play. We're happy. We're going to dance. We're sad. We're going to hug. We're angry. And when we're angry, we need our calm down thing. We're frustrated. We just want to lie down and close our eyes for a minute. And get those emotions, figure them out, name them for your child, have something to do about them, and then role play in the game. So it really works out well. And you'll find in the most boring places, like you're in the checkout line of the grocery store, your 2-year-old will say, okay, mommy, you be happy now. Okay, daddy, I want you to be angry. Where's your calm down? And they will role play that. So when they get into that point where they're angry or they're frustrated, you can say, what are you? You are angry. Where do you go with that? And that's a great game to learn about some of the self-regulation, to learn about the lingo of what's going on with your feelings, and to help develop some of those routines and those answers for when you're feeling that way.
Wonderful. These are just wonderful tips. I actually try to pick up on everything I learn about reading and singing, and now I have a new tool to just mimic facial. I know they love to mirror facial expressions and that to how they feel. Great. Life skills, maybe when they're starting school. Any tips for kids who are having, the issue with friendships and schoolwork and feeling overwhelmed?
So having some simple routines that you do in the morning before breakfast, when you come home from school, when you finish up homework. So, just kind of having we're done with homework. Okay, let's put all the pieces together back in our backpack so it's there ready first thing in the morning. But having that routines are important because it helps children understand what they can expect from us and what we should expect from them. So building routine into all of that is something that really helps out those life skills.
Perfect. We've come to put, as we're getting back to school, basically a chart on the mirror in the playroom so that my son can see what happens at each stage of the day.
Absolutely. And that again, the more they know that, the more that becomes part of that routine. It becomes something that feels very safe for kids.
Great. Any other tips on how to develop necessary life skills?
I think that the final thing I would say is that this involves a lot more one-on-one and parent-child time to do this. But it becomes something that you look forward to too as a parent, because your children expect it. They're glad to see you in through there. And this is part of the reason why you have kids, to have fun with them. So you're building life skills, but really you're doing it in the context of play, and you're finding ways that you both enjoy doing the things that you need to do to get to the next level.
It takes a lot of pressure off when you make it fun. And then you start to enjoy those skills and activities as a parent. So
True.
it's wonderful.
True. Mm-hmm.
It's wonderful to have that perspective and outlook as we go into parenting. Well, I want to say I'm so excited that you are local. People want to find you, and you've made a big transition from the East Coast to the West Coast.
I did. It's
We're
been great.
we're so lucky to have you in California. There's lots of opportunity here as far as California is growing as a state and the world of pediatrics. So thank you for being so involved in our communities and pushing forward and pioneering development and, as I mentioned, creating a real home for children with disabilities.
Well, thank you so much, Dr. Vivi. It's been great to talk with your fans, and it's been great to talk with you as well.
All right. I hope to see you again soon. Thank you.
All right. Take care. Bye-bye.